Jupal sir, over to you, sir. Yes, sir.
Okay. Thank you very much, Ganesh Kole sir.
Thank you, sir.
Good afternoon to all of you. Our association Rog Nidan, Academy of Rog Nidan, today presenting lecture series. In this lecture series today, Dr. Nandkishor Kale is going to deliver lecture on hypertension and Dhamani Pratichay with respect to Ayurvedic perspective. Dr. Nandkishor Kale is HOD and Assistant Professor at Gurukunja Mozari Ayurved College Mozari, Akola, in Rog Nidan department. He has teaching experience about 16 years UG. He has having research work experience in special tuberculosis and Ayurvedic formula and semen analysis. He has also got fellowship from MUHS Nashik as a research teacher. His area of interest is the peripheral smear regarding blood smear or other. His extracurricular activity is he is a well-known teacher in NSS. He is working as a program officer since 12 years in his college. He is also member of board students welfare in MUHS Nashik. He presented a lot of research papers in various research journals. We all know the Kale sir. In this today's lecture, he delivered regarding the hypertension and Ayurvedic approach. I request Dr. Nandkishor Kale sir to continue his lecture. Thank you very much. Over to Kale sir.
Okay, sir. Good afternoon, all the Rog Nidan faculties and my dear students of our college and students from the Sion Mumbai and different colleges from the Rog Nidan department. I initially very much thankful to the Academy of Rog Nidan for giving the platform to deliver my second lecture, which is hosted by the Academy of Rog Nidan and all the president, secretary, honorable president, secretary, and acting president, Dr. Dudmal sir, Dr. Convener of the Academy of Rog Nidan, Dr. Ganesh Kole sir. I initially thankful to all the members and executives of these Academy of Rog Nidan for giving the opportunity. Today's topic, in the previously I had delivered a lecture on semen analysis. Today's topic is hypertension and the Ayurvedic concept. Hypertension Hypertension, it is a very much a common problem. So patients are coming with the towards OPD. It is a vascular disease responsible for more morbidity and mortality than any other category of human disease. It is a vascular disease, and which is responsible for the more morbidity. Morbidity means patient to exaggerate the his general condition and leading to the mortality due to the hypertension. Hypertension affects small muscular arteries and arterioles. So what is today's our aim in this lecture is to study the pathogenesis and how the hypertension is going to occur. This is our main point of study. So the hypertension affects small muscular arteries and arterioles. Now what are the arteries and arterioles? This is very important thing. Small arteries are less than 2 mm in diameter, and arterioles are 20 to 100 micrometer in diameter, which lie within the interstitial connective tissue of organs. Metabolically active tissues have the highest capillary density. This is important thing because whenever we are thinking about the hypertension, the main organ involved, that is Moolasthana, according to that we can say it is the heart. And why heart and hypertension? This is the question. Because metabolically active tissues, which are having the large, highest capillary density, that is the heart, and hence heart and hypertension or heart. So before going for the hypertension, what is this systemic vascular resistance? The systemic vascular bed is a dynamic part of the circulatory system. Means the blood is flowing and there is supplying the blood to the different parts of the body, inferior vena cava, and all these things we are knowing that. And this vascular resistance or this vascular bed is important for the circulatory system. That means the blood supply to the heart and other organs of the body. This is very important thing. Hence, the systemic vascular blood is a dynamic part of the circulatory system. In the previous slide that we have seen, it is a heart is having the metabolic active tissue that is highest capillary density. That means these arteries and arterioles are having the huge network to the heart, and this is the dynamic part of the circulatory system. This is very basic mechanism that we should concentrate on. Arterioles are dynamic vessels that are able to alter their diameter, thereby altering their resistance according to the body's needs. Means whenever supply is there, the arterioles are going to change. They are reconstructing, or sometimes they are vasoconstriction will be there, sometimes vasodilatation will be there, and so that is affecting the normal blood flow of the blood flow. That is, we can say the pitta and rakta, we can say. We will discuss this further. This is Ayurvedic concept is concerned. So vasoconstriction, that is narrowing of these arteries, which is a vascular bed for the dynamic part of the circulatory system, that increases the systemic vascular resistance. This vasoconstriction, if the blood is flowing, 1 liter blood is flowing through that arteries, and if there is a narrowing of the arteries, and that systemic vascular resistance will increase. And this increase the systemic vascular resistance, that is SVR. This will be responsible for the increase or raise of blood pressure and reduce cardiac output. Blood pressure will be increased and cardiac output will be reduced. So in hypertension, systemic vascular resistance, this is a very important pathogenesis that we should concentrate on. Now, what is blood pressure? Blood pressure is equal to hypertension. So this is the thing. Every clinician asking, do you have BP? Now, what is blood pressure? Blood pressure is not, here it is not increase or decrease. What is the blood pressure? Blood pressure is the calculated sum of the cardiac output and the systemic vascular resistance. Cardiac output, we have seen, if there is increased systemic vascular resistance, it will raise to the blood pressure and reduce the cardiac output. So blood pressure is the multiplication of the cardiac output and the systemic vascular resistance. What is systolic BP? Systolic, two types of BPs are there. Systolic BP and diastolic BP is there. Peak pressure found in the arteries during ventricular contraction. We have seen the vascular highest metabolic active tissues. So peak pressure found in the arteries, this is the due to the ventricular contraction. This is the systolic BP. And diastolic BP is the lower BP that we can say. It is a minimum pressure found during ventricular relaxation. So ventricular contraction and ventricular relaxation. This is the one. This is the second important thing that we should concentrate while going for the measurement of the BP, which is a physiological parameter that should be evaluated in each and every patient of the patient. Now, vascular pathology, as we have seen initially, I have told the arteries and these are the involvement connected. Vascular bed is important things that we have discussed. So, what is the vascular pathology or principal mechanisms in case of the hypertension? It is a narrowing or complete obstruction of vessel lumina, either progressively. So, it requires some certain time to develop the hypertension. Or we can say it depends upon the aggravating factors or the risk factors such as diabetes mellitus, obesity, continuous stress in today's life, and the sedentary lifestyle, many of the things that we should concentrate. So, initially I have told what is our aim to study, that is the pathogenesis that we are going to concentrate, that how the hypertension is going to be initiated. So, narrowing or complete obstruction, that is aurod we can say, of vessel lumina, either progressively. The reasons are the atherosclerosis that we can see, or precipitously thrombosis or embolism. Due to certain disorders, causative factors are different. That we are, smoking is there, or aging process, atherosclerosis changes due to aging process, and many of the things that can be put over here. The basic thing in hypertension, that is the narrowing or complete obstruction of the vessel lamina. Second thing is weakening of vessel walls, causing dilatation and or rupture. Then you can see the hemorrhage. Many of the cases coming with the hemorrhages, acute attack, and that leading to hemorrhages and hemiplegia. Basic reason behind all these things, that is the hypertension. Is in the initial slide that we have seen morbidity and mortality that leading to the hypertension. So weakening of the vessel walls. This is again important pathogenesis. In case of the atherosclerosis that I have quoted, the elastic and muscular arteries are involved. That leads to the weakening of the vessel walls, and that leads to the that we can say the disturbances in the blood circulation, which is the basic mechanism for our body. The cellular components involved in the blood pressure or hypertension, that we can say. The blood vessel walls is there, endothelial cells are there, smooth muscle cells, and these collectively, comprehensively, these cellular components plays a central role in the vascular biology and pathology, as well living of the cells as well as the pathogenesis of the cell. Dilatation or rupture is there, or all these things are there. So this is important. Again, these are the very important cellular components that I want to quote here. They are playing a very important role in the living of the vascular cells. There's arteries, small arteries, and all these things, and also in the development of the pathogenesis, that is the hypertension. Now, atherosclerosis, now very important thing in case of the hypertension. What is atherosclerosis? So atherosclerosis is a slowly evolving lesion. Lesion means, I have some UG students are there. Lesion means you can say some obstructive. We can say Srotodoshti Samanya Lakshana Atiprati Sangova Shiranam Grantha Yoga. So this is Shira Granthi, we can say. It is obstructive pathology due to some calcification is there, or the collection of the cells, tissues due to certain regions. This is lesion that we can define. So atherosclerosis is a slowly evolving lesion, usually requiring many decades to become significant. This is very important thing. Requiring many decades to become significant. So patient is saying that he is smoking one cigarette per day and you will not having some. So if he is consuming the cigarette, one cigarette in a day, and he will consuming since last 10, 20 years. So suddenly you will be having the, after 15 years, you will having the atherosclerotic changes. And that leading to the hypertension, ultimately hemorrhage and hemiplegia already. Morbidity and leading to morbidity and mortality. Due to the atherosclerosis, he is developing the hypertension. This is important thing. So however, acute plaque changes, example, rupture of the heart we are discussing. Rupture of the cells, thrombosis, hematoma, that is our Shira Granthi that we can say. Formation can rapidly precipitate clinical sequelae. This is important thing. It requires certain time, and that will leading to the some complications. So this is the so-called clinical horizon is so-called. Hence the hypertension, hence the atherosclerosis. It is a systemic disease. So many of the systems, because the network of the arterioles and arteries, so spread all over the body. The Srotasa is discussing our Cherakimastan, that is Yavante Pursya Murtimanta Bhavisha, Tasmin Yavan Srotasa Pekara. जो मूल है उसका, तो ये पूरे बॉडी में हो रहा, तो yes, it is a systemic disease. This endothelial injury that leads to endothelial injury to the intima of the blood vessels, that we can say, that leads to the thrombosis, atherosclerosis, and hypertensive vascular lesions. Hypertensive vascular lesions, that means you can say some development of the calcification is there, or hyperlipidemia is there. So they are gradually they are going to deposit in the intima of the small vessels, and that leading, this is called as the hypertensive vascular lesions are forming. And that will lead in, we are saying that abhi to acha tha aur usko he is having sudden acute attack. So these are the things they are making the pathogenesis or making the solid ground for the development of the atherosclerosis and for the development of the hypertension, thrombosis, atherosclerosis, hypertension, vascular lesions. Excessive thickening of the intima that leads to this excessive thickening of the intima. This leads to the luminal stenosis. This is important pathogenesis, and this luminal stenosis in the blood vessels that blocks the vascular flow. जो अवरोध है, जो ब्लड फ्लो उसमें से हो रहा है, एक ये वन इंपॉर्टेंट थिंग आयुर्वेद ने बताई है कि देहस्य रुधिरम मूलम रुधिरे नेव धारित। जो देह का मूल क्या है, देहस्य रुधिरम मूलम, रक्त ये देह का मूल है, रुधिरे नेव धारित है, बिकॉज इट इज, ये धारण कर रहा है अपने बॉडी को, जो रुधिर है, जो रक्त है, वो बॉडी को धारण कर रहा है। तस्मात् यत्रेण संरक्षण रक्तम जीवम इति स्थिति, उसका संरक्षण क्यों करना है? सो इन ऑर्डर टू अवॉइड दी कॉम्प्लिकेशंस, in order to avoid these complications and in order to avoid the morbidity and mortality, आयुर्वेद अगर कहता है कि तो उसको उसका संरक्षण करना बहुत जरूरी है। Now, what are the basic consideration of the hypertension? Multiple risk factors have a multiplicative effect. The two risk factor increases the risk approximately fourfold. कोई भी अगर you can say 10 risk factors है, तो you are having the only two risk factors, they can lead to the hypertension and ultimately the morbidity. Even the alcohol consumption, you can say, even the cigarette smoking, these two factors can lead to the this hypertension, or we can say the continuous stress in today's life, continuous stress. So this can be people having the insomnia, जो निद्रानाश आज के इसमें हो रहा है इस लाइफ स्टाइल में. So this nidranash, we can say, it is a very hazardous thing that is developing the hypertension. So hypertension is another major risk factor for atherosclerosis. Systolic and diastolic levels, these are very important things that we have. This systolic and diastolic blood pressure level that should be evaluated in each and every case. I want to tell you one important thing. You should record the, I am also telling my students, you should record the blood pressure of each and every patient approaching towards you, even though he is not having any symptoms. Because some patients are symptomless, that we have seen the atherosclerosis required many decades to develop the atherosclerosis, which is an important risk factor for the hypertension. So left ventricular hypertrophy in many cases probably represents a marker of long-standing functional hypertension. This is important thing. See, the patient is coming. The LVH जो है left ventricular hypertrophy. You see that I will tell the clinical picture of the left ventricular hypertrophy. Patient is coming with the dyspnea, gross swelling is there, pedal edema is there, facial edema is there, gross pitting edema is coming with the gross pitting edema. Obesity is there, dyspnea is there. Patient कहता है मुझे थोड़ा लगे तो दम लगता है. Coughing may be there. Or palpitation is that. These are the very cardinal symptoms in case of the left ventricular hypertrophy, and that leads to this standing functional hypertension. Patient को बहुत दम लगता है, चलने के बाद उसको लगता है कि कोई करने की इच्छा नहीं होती. This is clinical sign. So you should go for that. You should go for the जो वैद्य समय के लक्षण उसमें मिलना चाहिए, वो है pitting edema. आपको उसके जो pedal edema है, you should go for the evaluation of the pedal edema. So atherosclerosis is a chronic inflammatory response. What is atherosclerosis? Response is the body. The response is there due to chronic inflammation of the vascular wall to a variety of insults. जो क्या है atherosclerosis, including endothelial injury. Endothelial कुछ injury हो रही है intima को, blood vessels को. और मैंने I have discussed the lipid accumulation जो है, lipoprotein जो है, cholesterol very commonly cholesterol है, तो वो अगर hypertension है तो you should go for the evaluation of the lipid profile. अगर lipid profile बढ़ रहा है तो उसको BP, that is you should go for collaboration with the things. So lipid accumulation is dangerous. That is, we can say hyperlipidemia and oxidation and thrombosis embolism. Hypertension, one of the risk factor for ischemic heart disease. और पेशेंट बोलता है मैं गोली ले रहा हूँ, अभी बीपी कम है इसलिए छोड़ दिया, तो फिर you will develop again the pathogenesis still going continue in the body. सो ये जो थिंग, ये प्रैक्टिकल डिफिकल्टीज है हाइपरटेंशन में. आई थिंक you should not neglect, because you know to avoid the morbidity and mortality. It is very important thing to measure the blood pressure of each and every patient approaching towards you in order to avoid the ischemic heart disease, angina pectoris, or cardiac arrest. This, so it depends upon the how the clinician is conscious about towards his patient. This is important thing. Hypertensive vascular disease. So what is hypertension? It is an elevated blood pressure, nothing but blood pressure. Systolic diastolic, what we have discussed. So it is an hypertension. It is a major risk factor for development of the atherosclerosis, because obstruction is there, and these are the collaborative things that we can say. Hypertension is a common health problem. Typically remains asymptomatic until late in its course. I have discussed this. See, patient क्या है कि वो उसको symptom नहीं दिखाता है. Since long he is asymptom, and suddenly he will coming towards you, and I am having the restlessness and chest pain and all these things. The pathogenesis is still, gradual pathogenesis is happening in the body. And yes, I have told you should go for the checking of the blood pressure in each and every patient. This is important things, because typically remains asymptomatic until late in its course. जब जो late होता है patient, so अपने हाथ में कुछ नहीं रहता, फिर उसको you cannot do anything. So recording of the BP, at least वो patient को एवढी alternate day उसको बुलाना चाहिए कि उसका आपका BP रिकॉर्ड करना है. You should not more conscious, and patient should not more conscious about it. Patient को भी ज्यादा एंक्शियसनेस नहीं बढ़ाना चाहिए. प्रैक्टिकल अप्रोच बोल रहा हूँ, पेशेंट का ज्यादा एंक्शियसनेस मत बढ़ाओ और खुद भी एंक्शियस मत हो जाओ. तो यू शुड रिकॉर्ड एंड यू शुड गिव दी, क्या बोलेंगे उसको, सपोर्ट देना चाहिए पेशेंट की नहीं, यू विल बी हैविंग, यू विल बी फ्री फ्रॉम दिस. So sustained diastolic pressure. So what blood pressure is? Sustained diastolic pressure greater than 90 mmHg, or a sustained systolic pressure in excess of 140 mmHg constitutes hypertension. So this is important thing. Diastolic pressure ये 90 mm के ऊपर होना चाहिए, और 140 के ऊपर है तो उसका यूज फिर थिंक. अगर ऐसा ठीक है तो फिर बाकी जो आयुर्वेद क्या बोलता है कि दुष्यम देशम बलम कालम अलनम प्रकृति वयम तथा, ये जो बातें हैं उसकी प्रकृति क्या है, उसका बिल्ट कैसा है, ये सब बातें डिटरमाइन करती है. अगर 140 90 144 एक पेशेंट में बीपी बोल रहा है, 144 और 92 है समझो, सो 94 90 है तो सो यही, और उसकी प्रकृति क्या है, उसका वय क्या है, उसके रिस्क फैक्टर क्या है, वो टेंशन में है क्या, ये सब बातें आपको ख्याल में रखना है, ऐसा आयुर्वेद का कहना है. ये सब बातें आपको यू शुड कीप इन माइंड एंड यू शुड काउंसिल टू द पेशेंट. आपको काउंसलिंग करना है पेशेंट का. सो सिस्टोलिक ब्लड प्रेशर इज मोर इम्पोर्टेंट than diastolic in determining cardiovascular risk. This is the underlying point that you have to calculate. Systolic blood pressure जो है, जो 130-40 बोल रहे हैं आप, नॉर्मल बोल रहे हैं, तो ये 140 के ऊपर जब जाता है तो you should be conscious to the pressure. The kidneys and the adrenal secondarily are the central players in blood pressure regulation. इसलिए तो क्या ब्लड यूरिया सीरम क्रिएटिनिन किया जाता है हमारे हॉस्पिटल में. Regularly blood urea serum creatinine in pathology we are performing. This should be evaluated कि उसकी किडनी फंक्शनिंग कैसा है, ये बहुत इंपॉर्टेंट बात है. Interact with the other to modify vessel tone and blood volume. Now the essential hypertension that we have discussed, how the atherosclerosis is linked. So what is pathogenesis of the essential hypertension? Idiopathic cause unknown है, primary है. Elevated BP with unknown cause. This is the thing. 90 to 95% cases जो अप्रोच हो रहे हैं अपने तरफ तो essential hypertension में होते हैं. Essential hypertension and interplay of multiple genetic and environmental factors affecting cardiac output or peripheral resistance. जो initially I have discussed, जो दिए मैंने initial slide में, cardiac output जो blood pressure is cardiac output into systemic vascular resistance. So essential hypertension, it is genetic and environmental factors affecting cardiac output and or peripheral resistance. So जो genetic factors है, आपके फैमिली में किसी को ब्लड प्रेशर की हिस्ट्री है, एनवायरमेंटल फैक्टर्स है, इसके वजह से कार्डियक आउटपुट और पेरिफेरल रेजिस्टेंस में वो अफेक्ट कर रहा है. and only we have seen these things are affecting. So that will lead into the hypertension. Compatible with long life unless a myocardial infarction, cerebrovascular accident, or other complication supervenes. Essential hypertension की इनिशिएटिंग इवेंट क्या है essential hypertension में reduce sodium excretion जो सोडियम ले रहे हैं अपन साल्ट में से तो in the presence of normal arterial pressure. This is the final common pathway for the pathogenesis of the most forms of the hypertension. जो सोडियम रिटेंशन जो हो रहा है साल्ट रेस्ट्रिक्शन क्यों किया जाता है पेशेंट में से दिस इज द थिंग. ये सोडियम रिस्ट्रिक्शन में भी पित्त जो है वो पित्त रक्त में चला जाता है. मैं आगे बताऊंगा आपको. पित्त रक्त में चला जाता है, लिक्विडिटी बढ़ती है. तो ये दिस लिक्विडिटी दिस इज द सोडियम एक्सक्रीशन दैट वी कैन सी. और ब्लड का वॉल्यूम बढ़ रहा है तो नेचुरली अल्टीमेटली इट विल एक्सर्ट द प्रेशर ऑन द ब्लड वेसल्स. सो दिस रिड्यूस्ड सोडियम सिक्रीशन एक्सक्रीशन बॉडी में वो कंजेशन होते रहता है, उसका संग हो जाएगा. मल संग जैसे बोलते हैं उनके मल संग, उसका वो स्वाद का संग हो जाएगा. दिस इज द सोडियम रिड्यूस सोडियम एक्सक्रीशन एंड ऑब्लिगेटरी इंक्रीज इन फ्लूइड वॉल्यूम. फ्लूइड वॉल्यूम बढ़ेगा एंड इफ फ्लूइड वॉल्यूम बढ़ रहा है 5 to 6 लीटर ब्लड है वो जा रहा है 7 लीटर तक. सो अल्टीमेटली इट विल इंक्रीज द कार्डियक आउटपुट एंड अल्टीमेटली द एलिवेटिंग द ब्लड प्रेशर. बॉडी कैनॉट टॉलरेट vascular changes of the essential functional vasoconstriction or changes in vascular wall structure. So results in increased resistance. Resistance is what? It is a systemic vascular resistance that we have discussed initially. And this chronic functional vasoconstriction, that means the constriction of the vessels that result in permanent structural thickening of the resistant vessels. So this is very hazardous and patient will be in the cardiac arrest. And reason is essential hypertension. Genetic factors involved. Studies comparing blood pressure in monozygotic and dizygotic twins. Studies of familial clustering of hypertension clearly establishes strong genetic component. So we should not go for the genetic involvement. Both important है. Allelic variations in the genes encoding components of the renin angiotensin. जो ये है renin angiotensin system जो है renin angiotensin converting enzyme जो है kidney में जो. So this is a important thing. When the kidney function test is done, hypertension is associated with polymorphism in both the angiotensin locus and the angiotensin 2 type 1 receptor. Polymorphism is that is the many forms of the genes that we can see. So this genetic involvement you can just keep in mind कि genetic in factor जो है उसका role hypertension development में है. उसको फैमिली हिस्ट्री लेना जरूरी. यूजी के स्टूडेंट को मैं बोलता कि मातृकुल पितृकुल और जो स्वकुल अपना जो केस टेकिंग में दिया है बहुत इंपॉर्टेंट चीजें है. जो केस पेपर है लॉन्ग के शॉर्ट केस की वो बहुत इंपॉर्टेंट है. ईच एंड एवरी पॉइंट उसमें जो दिया है वो बहुत इंपॉर्टेंट है. Essential hypertension environmental factors क्या अफेक्ट हो रहे हैं. मॉडिफाई द एक्सप्रेशन ऑफ द अंडरलाइंग जीन्स डिटरमिनेंट्स ऑफ हाइपरटेंशन. सो मैंने इनिशियली वी हैव डिस्कस स्ट्रेस है, कंटिन्यूस स्ट्रेस, ओबेसिटी है, स्थूलपना है, स्मोकिंग, फिजिकल इनएक्टिविटी. दिस इज इंपॉर्टेंट. फिजिकल इनएक्टिविटी आयुर्वेद में बताया अव्यायाम है दिया स्वप्न मैदान चाहती भक्षणार्थ जो है कि दिस इज फिजिकल इनएक्टिविटी जो आजकल लोग में हो रही कि वो दे आर नॉट विलिंग टू डू द फिजिकल एक्टिविटी. So physical inactivity, this is a very hazardous thing. Heavy consumption of the salt, this is also the risk factor. Vascular pathology, in addition to accelerating atherogenesis, hypertension associated degenerative changes in the walls of the large and medium arteries can potentiate both aortic dissection and cerebrovascular hemorrhage. जो atherogenesis, what is atherogenesis? Atherogenesis means जो atherosclerosis we can see. Genesis means formation. जो arteries में जो formation हो रहा है, जो background तैयार हो रहा है hypertension development के लिए, उसको बोलेंगे अपन atherogenesis. And this atherogenesis that leading to the aortic dissection and cerebrovascular hemorrhage. कोई भी आता है अचानक उसको अटैक आ गया. देखो अभी मोस्ट ऑफ द सेलिब्रिटीज कैन से हार्ट अटैक से गए. साउथ का एक हीरो है, बहुत सारे लोग हैं बिकॉज दे आर नॉट they are, I think they are extra conscious about their health, extra consciousness, जिम लगाइए वो लगाओ. This is हर अपनी तरफ बहुत important एक वेपन है. योगा है, योग और आयुर्वेद जो है, this is very much powerful weapons with us, so we can avoid the this cerebral hemorrhage जो है, जो अपने हाथ में नहीं है. पेशेंट सडन हो रहा है, वो हाथ में नहीं है तुम्हारे. तो ये जो वेपन, ये वेपन से वो हाइपरटेंशन की जो पैथोजेनेसिस डेवलप हो रही है, एथेरोस्क्लेरोसिस और जो सेरेब्रल हेमोरेज, सेरेब्रल वेस्कुलर हेमोरेज जो है, ये तुम्हारे हाथ में, तुम मुट्ठी में लेके चल सकते हो उसको, वो आयुर्वेद और योग के माध्यम से. Also associated with two forms of small blood vessel disease. So this is again I will quote this. These are the we'll discussing the hyaline arteriosclerosis. As far as pathological point of view is concerned, pathological point of view है, तो hyaline arteriosclerosis and hyperplastic arteriosclerosis. So you this is the hyaline arteriosclerosis, vascular pathology as far as hypertension is concerned. Vascular lesion. Now, what is hyaline arteriosclerosis? That is developing the we can say covagunya for the development of the hypertension. So vascular lesion consists of a homogeneous pink hyaline thickening of the walls of the arteries with loss of underlying structural detail and with narrowing of the lumen. We are initially we are discussing narrowing जो हो रहा है lumen का. So this is the basic pathogenesis. Also common as a part of the characteristics microangiography in diabetes. So microangiography जो diabetes and hypertension, this is very now very much many of the cases they are coming with many of the cases are coming with no symptoms at all. Even though diabetic patients are not having symptoms, or the hypertension patient not having any symptoms, or the patient is coming with having vertigo since last 8 days, बहुत चक्कर आ रहे मुझे ऐसा बोलता है पेशेंट. तो उसको एक पेशेंट अभी 2 दिन पहले in our hospital approach and pathology is having the only vertigo is there. One lady is there. Or we have evaluated blood sugar. It was found 300 plus blood sugar random was there. So you can imagine, see the main. So you should not neglect. मैं initially मैं बोला कि आपका consciousness कितना है clinician, how you are conscious clinician बोलेंगे उसमें, तो उसको you can avoid the such incidences, cerebrovascular hemorrhage and morbidity and mortality. So while hyaline arteriosclerosis जो है, तो major morphologic characteristics of benign nephrosclerosis, in which arterial narrowing causes diffuse impairment of renal blood supply with loss of nephrons. So kidney का involvement क्या है, more important. Kidney का involvement जो है इसमें तो है, that is the hyaline arteriosclerosis. Hyperplastic arteriosclerosis. Characteristics of malignant hypertension. Essential hypertension that we have discussed. So malignant, which is dangerous, we can say malignant hypertension. It is due to the hyperplastic arteriosclerosis. Diastolic pressure over, you see, our 80 mm of Hg is the normal blood pressure. Diastolic pressure over 120 mm of Hg associated with acute cerebral or renal injury. You can say renal involvement, kidney is involved. So onion skin, that is luminal obliteration. Luminal obliteration is a occlusion. So these are the characteristics of the hyperplastic arteriosclerosis, which is vascular pathology that we can say. We can say the basic mechanism of involvement that we can say. So hypertensive emergencies that leads to the progressive end organ dysfunction. This is the very important thing that leading to the morbidity. So hypertension emergency जो है हो रही थी, हेमोरेज है, थ्रोम्बोसिस, एम्बोलिज्म है, एथेरोस्क्लेरोसिस, प्रोग्रेसिव एथेरोस्क्लेरोसिस है, so obesity है, diabetes है, उसमें microangiography that we have discussed. All these are the hypertensive emergencies. They are attacking on the heart, and that ultimately that leading to the progressive end organ dysfunction. बाकी के जो organs है, they are going to dysfunction. So this is the picture from the Robbins basic pathology. What we have discussed, that is the left side में जो है hyaline arteriosclerosis, जो arterial wise hyalinated, that we have discussed. So hyaline arterial, this is the picture that we can say. So hyaline arteriosclerosis and the second of जो figure है, जो marking is there. So this is the hyaline arteriosclerosis and second one is another is arteriosclerosis. Now this secondary hypertension, it is caused by the diseases of the kidneys or endocrine glands. We have discussed the malignant hypertension is there, or initially we have discussed the primary hypertension, and this is the secondary hypertension caused by the disease of the kidneys or endocrine glands. So what is the renal causes behind the development of secondary hypertension? Acute glomerulonephritis, chronic renal diseases, CRF, polycystic diseases, renal artery stenosis, renal vasculitis. These are things we can elaborate it. Renin producing tumors. Endocrine causes क्या है? Renal causes or endocrine causes for the development of the secondary. Adrenocortical hyperfunction, Cushing syndrome जो है वो है. Pheochromocytoma, chromatin cell tumor है. Acromegaly है. Gigantism जो है endocrine. Hypothyroidism, myxoedema जो है. So these are the endocrine causes. In today's practice, many of the cases are coming with hypothyroidism or hyperthyroidism, thyroid obesity. The continuous stress and lifestyle changes, all these are the factors. Pregnancy induce also the secondary hypertension. Cardiovascular causes, coarctation of the aorta, polyarterial notice or PAN जो बोलेंगे उसको, so उसमें malaise रहेगा, fever, weight loss, hypertension. These are the common symptoms in the polyarteritis. No, sir. Increase intravascular volume, increase cardiac output. Cardiac output increase cardiovascular and rigidity of the aorta. Neurological causes for the secondary hypertension. Psychogenic, increase intracranial pressure, ICP, sleep apnea, temporary cessation of the breath, acute stress. Investigations. Basic investigations क्या करना है अगर patient with elevated BP symptoms लेकर कुछ आ रहा है, कुछ को दम लगा, भ्रम है, तो उसको you have recorded the BP is about 148 or 94 something is there. So exclude the secondary hypertension. वो उसको secondary hypertension exclude करना है. उसको देखो kidney function क्या बोल रहा है उसका वो देखना है, और thyroidism कुछ है क्या, obesity है क्या, इसका age factor क्या है, प्रकृति कैसी है, all these things that you should पहले आपको क्लिनिक में ये सब इवैल्यूएट करना है before going for the laboratory investigations. So this meaning that the exclude secondary hypertension. Second important जो कि you go for the primarily you are doing the blood pressure in clinic, and secondarily you go for the electrocardiogram. Electrocardiogram पहले आप देखो उसमें कुछ चेंजेस है क्या, कुछ इस्केमिक चेंजेस है क्या, कुछ क्या बोलेंगे एक्सिस डेविएशन है क्या, कुछ ये चेंजेस आपको बेसिकली देखना है. और लिपिड प्रोफाइल बाद में, लिपिड प्रोफाइल पेशेंट कैटेगरिक रहो, कैसा रहो, ओबेस रहो, वो लिपिड प्रोफाइल आपको रोल आउट करना है. उसका लिपिड प्रोफाइल क्या होता है, एथेरोस्क्लेरोसिस कुछ डेवलपमेंट है क्या, उसके साइज मिल रहे क्या, ये सारा है. बाद में इम्पेयर्ड ब्लड शुगर लेवल, आपको डायबिटीज है क्या पेशेंट, ये भी देखना बहुत इंपॉर्टेंट है. यूरिया एंड यूरोट्राइट्स, ब्लड यूरिया, सीरम क्रेटिनिन, सोडियम, पोटेशियम, इम्पेयर्ड थायराइड फंक्शन टेस्ट और ऑल दिस थिंग्स जो है उसको रूल आउट करना है कि थायराइड है, डायबिटीज है, ईसीजी में क्या चेंजेस आ रहे हैं, और हाइपर कोलेस्ट्रेमिया है क्या, हाइपरलिपिडेमिया है क्या, लाइपोप्रोटीन्स का उसका फंक्शन कैसा है, ये सब बातें आपको करना है. सो आप जो है कि मैंने बोला कि आयुर्वेद और योग जो है, सो ये इतना ऐसा होता है जो लाइफ जो है, दुधमल सर मुंबई में रह रहे, तो ये मुंबई का लाइफ ऐसा है, ये सब इतना कॉम्प्लिकेटेड अगर लाइफ रहेगा तो स्ट्रेस एंड ऑल दिस थिंग, एथेरोस्क्लेरोसिस चेंजेस, तो ये ऐसा लाइफ में नहीं होना चाहिए, इतना कॉम्प्लिकेटेड लाइफ से ये होना है, टू बी अवे होना है। तो मैं जहाँ तक मेरा एक्सपीरियंस है, बहुत सीनियर फैकल्टीज है यहाँ पे, अभी मुझे डॉक्टर दैलेकर सर भी दिखे, वो पारुल यूनिवर्सिटी से है, दे आर द एक्सपर्ट्स, आई थिंक आई एम नॉट। सो व्हाट जो मेरा पढ़ाई रही है, तो रक्तपित्त जो मुझे लगता है कि रक्तपित्त की जो संप्राप्ति है, जो अभी तक आपने देखा कि पैथोजेनेसिस दैट वी हैव डिस्कस, तो रक्तपित्त में जो चरक चिकित्सा में जो बताया कि तैर हेतु भी समुत्कृष्टम पित्तम रक्तम प्रपद्यते तद्योनित्वात् प्रपन्नम च वर्धते तत् प्रदूषयेत तस्योष्मणा द्रवो धातुर्धातो प्रसिच्यते स्विद्दतस्तेन संवृद्धि भूयस्तदधिगच्छति। जो रक्त और पित्त जो है, तो जो हेतु का सेवन होगा, आयुर्वेद जो बोलता है कि उपरोक्त हेतुओं से बड़ा हुआ पित्त अपने स्थान से हटकर रक्त धातु में चला जाता है। ये देखो, तैर हेतुर भी समुत्कृष्टम, जो पित्त बड़ा हुआ है, समुत्कृष्ट पित्तम रक्तम प्रपद्यते, जो बड़ा हुआ पित्त है वो रक्त धातु में चला जाता है, और वह पित्त रक्त से ही उत्पन्न होने से उस रक्त में जाकर अधिक बढ़ जाता है। पित्त की उत्पत्ति कहां से है? रक्त से है। फिर वो रक्त और बढ़ जाता है, पित्त अधिक बढ़ जाता है तथा उस रक्त को दूषित कर देता है। उस पित्त के ऊष्मा से, देखो तद्योनित्वात्, इस पित्त की उत्पत्ति, पित्त जो है वो रक्त से ही निकलता है। ये तद्योनित्वात् प्रपन्नम च वर्धते तथा प्रदूषयेत, ये पित्त जो है वो रक्त को दूषित कर देता है। फिर आगे क्या होता है? तस्योष्मणाम द्रवो धातुर्धातु प्रशिष्यते, उस पित्त की उष्णता से मांस आदि द्रवात्मक धातुओं से द्रव धातु निकलता है। तस्योष्मणा द्रवो धातुर्धातु प्रशिष्यते, उसको प्रशिष्यते दैट इज अतिक्षरति, उसका सिक्रेशन बढ़ जाता है। जो धातु के जो द्रव है उसमें से द्रवात्मक धातुओं से द्रव धातु निकलते, ज्यादा से ज्यादा द्रव धातु निकलेगा। व्हाट इज द रीजन? बिकॉज ऑफ द स्विद्दतेन स्विद्दत्य प्रशिष्यते दैट इज अतिक्षरति। अतिक्षरति इज द एक्सेसिव सिक्रेशन। सो व्हाट इज हैपनिंग, उसका जो द्रव धातु है, लिक्विडिटी जो है पित्त और रक्त की, वो बॉडी में बढ़ रही है। सो द्रव धातुओं के धातुओं से निकलने के कारण पित्त और अधिक बढ़ जाता है। सो दिस इज दी रक्तम प्रपद्यते, जो है रक्तम प्रपद्यते, वो ऐसा पित्त ये रक्त में चला जाता है। तो रक्तम प्रपद्यते अर्थात जो पित्त है वो रक्त में चला जाता है, और जो धातुओं में से जो द्रव निकल रहा है बिकॉज ऑफ द एक्सेसिव हीट ऑफ द पित्ता, दी जो धातु है वो धातु में से लिक्विड ज्यादा बढ़ने लगता है, द्रव धातुओं का निकलना हो जाता है। तो इसकी वजह से उसका वॉल्यूम बढ़ जाएगा, इट विल एक्सर्ट द प्रेशर ऑन दी ब्लड वेसल्स। सो पित्त की उष्मा से स्विद्यमान बोला है, स्विद्यमान यानी द्रव निकालते, धातुओं से निकले हुए द्रव रूप धातु से युक्त पित्त युक्त रक्त और अधिक बढ़ जाता है। मीन्स व्हाट इज द इम्पोर्टेंट थिंग जो है आयुर्वेद के हिसाब से जो रक्त पित्त में बताया है कि ये जो पित्त युक्त रक्त है उसका द्रव गुण बढ़ जाता है। पित्त युक्त रक्त का द्रव गुण बढ़ने से उसका लिक्विडिटी बढ़ेगी और दैट विल लीड टू दी हाइपरटेंशन। सो अनदर इम्पोर्टेंट मुझे लगता है कि विशेषतः वातज रक्त पित्त जो है, वातज रक्त पित्त चरक चिकित्सा अध्याय 29 में जो बताया चिकित्सा स्थान में कि जो वातज रक्त वात रक्त के जो लक्षण दिखते हैं, तो जो सिम्टम्स ऑलरेडी वी हैव डिस्कस्ड, यू कैन सी दी विशेषतः शिरायाम शिरा आयाम शूल स्फुरण तोदनम श्योतस्य कार्ष्णम रोक्षम च शावता वृद्धि हानया धमने अंगुली संधिनाम संकोचो अंगग्रहो अतिरूप कुंचन स्तंभने शीत प्रदेश अनिल अधिके। जो वातज वात रक्त के जो लक्षण है कि वायु के अधिक होने पर वात रक्त रोग में विशेषकर शिरा में तनाव, विशेषतः शिरायाम शूल जो है शिरा में तनाव, स्फुरण तोदनम शूल तोदन और फरफराट और तोद होता है, ये लक्षण मिलेंगे वातज वात रक्त में जो हाइपरटेंशन के मिलते हैं। और शोतस्य कार्ष्णम जो मैंने इसीलिए आयो डिस्कस की, शोध जो है पेटी गिरने वाले के पेशेंट आता है, बहुत दिनों से उसको चलने में तकलीफ होती है, पेटी गिरने वाले कहते हैं, दिस इज द शोतस्य कार्ष्णम। वो शोत्र काले रंग का होता है। रुक्षता रोक्षम च शावता वृद्धि आने, रुक्षता बढ़ जाती है और शोत में शाव वर्ण भी होता है, शावता वृद्धि हानय। बाद में धमनी अंगुली, धमनी अंगुली संधि नाम संकोचो ग्रहो अतिरोग। धमनी अंगुली और संधि में संकोच हो जाता है, तो कंस्ट्रिक्शन जो वी आर डिस्कस वेसो कंस्ट्रिक्शन जो डिस्कसिंग की आपने, जिसमें से सिस्टमिक वेस्कुलर रेजिस्टेंस जो मॉडर्न के हिसाब से, तो देखो धमनी अंगुली संधि नाम संकोचो अंग ग्रहो अतिरोग। जो धमनी अंगुली और संधि में संकोच हो जाता है, अंगों में जकड़ाहट हो जाती है, संकोच अंग ग्रहो अतिरूप, ये जो है जकड़ाहट बॉडी लेके आता है पेशेंट। बहुत देखो ये बहुत केसेस में ऐसा भी सिम्टम्स मिलता है हाइपरटेंशन पेशेंट इज हैविंग बॉडी अप, ओनली ही इज कमिंग विद द बॉडी अप, सो यू रिकॉर्ड द बीपी, यू विल बी डेफिनेटली द हाइपरटेंशन इन केस ऑफ दिस। सो धमनी अंगुली संधि नाम संकोचो ग्रहो अतिरूप। So these are the very typical symptoms in वात रक्त we are getting in case of the hypertension. So कुंचन स्तंभने अंगों में टेढ़ापन, कुंचन स्तंभने जकड़ाहट, और रोगी कुंचन स्तंभने शीत प्रदेशे अनिल अधिके, शीतल आहार विहार जो है, शीतल वस्तुओं से उसको घृणा होने लगती है। तो ये चरक चिकित्सा में जो दिया है कि वातज जो है, तो वो इसके लक्षण से कुछ है, बहुत कंसेप्ट है। माधुनिधर में भी दिया है कि स्वेदो की संप्राप्ति करके की ये सब बहुत चरक चिकित्सा में है, माधुनिधर में है, बहुत सारी चीजें है। So that can be discussed according to Ayurveda. So I have tried to experience. तो आपको क्या करना है कि जो इम्पोर्टेंट थिंग है हाइपरटेंशन अवॉइड करने के लिए, मैंने बोला कि योग और आयुर्वेद जो है, जो वेपन अपने पास है, तो क्या बोलते हैं योग आयुर्वेद, ओनली वे टू कीप योर हेल्थ इज टू ईट व्हाट यू डोंट वांट टू ईट, है ना। तो आपको जो खाने की इच्छा नहीं होती है उसको खाना है, आपको अवॉइड करना है। हाइपर कोलेस्ट्रॉल आपको अवॉइड करना है। आपको जो करने की इच्छा नहीं होती, आपको घूमने की इच्छा नहीं होती, 5 किलोमीटर 4 किलोमीटर जाने की इच्छा नहीं होती, तो आपको वो करना है। तो ओनली वे टू कीप योर हेल्थ इज टू ईट व्हाट यू डोंट वांट टू ईट, और ड्रिंक दैट यू डोंट लाइक टू ड्रिंक। आपको क्या ड्रिंक, ब्लैक टी आपको इच्छा नहीं होती तो आपको लेना है, वो ज्यादा मिल्क वाला दूध नहीं लेना। तो ये जो चीज है, ड्रिंक व्हाट यू डोंट लाइक टू ड्रिंक, डू व्हाट यू डोंट एंजॉय टू डू। सो ये इसको हेल्दी रखने के लिए ये सब चीजें बहुत इंपॉर्टेंट है। सो आई हैव ट्राइड to share my experience. I have told that many of the faculties are they knowledgeable person, eminent personalities in this session. They have joined, and I am very much pleasures to have talking and to present my topic over here. And again, I will be thankful to the Academy of Rognidhan for giving the opportunity to share my experiences, to upgrade the knowledge, to upgrade my knowledge. Again, I thank to all the faculties of the Rog Nidan and all the my dear students. Thank you, all of you again, and I conclude this session. Thank you all.
Okay. Thank you very much, Dr. Nandkishor Kale, sir. This nice presentation. Actually, this topic was given to me, Dr. Saleh sir, during the PMD. You know, elaborated all things regarding the hypertension, modern concept as well as Ayurvedic concept. Before going to vote of thanks, I request some eminent persons has joined this session, especially Dr. Hange sir, Dr. Darshana madam, Dr. Archana Kulkarni madam, Dr. Dahilekar sir. If any query or any input, Gita Sathode madam, Gayatri is, I think she is student. Bhojraj Chaudhary sir. Lot of eminent persons has joined this session. I think Dr. Hange sir, please give your inputs regarding the hypertension as a Ayurvedic aspect or any other. Hello. हाँ Hange sir. Archana madam. Dailekar sir has left. Okay, if anyone having queries regarding this topic, please raise your hands or put your queries in box, or you can unmute yourself and ask the queries. हाँ भोजराज चौधरी सर काय बोलना. हॅलो.
नाही सर, छान सांगितलं.
वेलकम सर.
अच्छा हुआ लेक्चर.
वेलकम सर.
अच्छा बताया सर ने एक्सप्लेनेशन किया है. जब रक्त की दुष्टि होती है और वात और पित्त के साथ में आता है तो हाइपरटेंशन बनता ही है शरीर में.
यस.
ये कंसेप्ट अच्छा हुआ है सर का. थैंक यू.
हाँ अर्चना मैडम. हेलो. हाँ गीता मैडम, you can hear. Okay. Actually, Sandeep Dailekar was joined this session, but he is left. Okay, no problem. All students, if you have any doubts, please ask. Okay, we are now we are concluding this session. Thanks to Dr. Nandkishor Kale for giving this very useful lecture regarding the hypertension and Ayurvedic perspective. Thanks to our Rog Nidan department's Academia of Rog Nidan's President and Secretary Pawan Kumar sir and Atul Vashni sir and all other respected our teachers and students for joining this session. Thanks to all. Here I am stopping this Zoom session. Thank you very much.
Thank you, sir.
Thank you, sir. Thank you.
Okay, bye.